Richard Nobles, and I serve as chair of the Licensed Psychology Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. Today is Tuesday, the 12th of August, 2025, and I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Linda Heitzman Powell has indicated that she will not be here. David Stevens,
Here.
Jennifer Fontaine.
I'm here.
Matthew Gulker is not going to be in attendance. Jessica Hamilton.
I'm present.
Edward Hunter.
I'm here.
Tiffany Johnson.
Here.
Sarah Kirk.
Here.
Christopher Leonard.
Here.
Jay Middleton.
Here.
And Robert Twillman.
Here.
I also note the following staff members are present: David Fye.
Here.
And Leslie Allen.
Here.
Now, David Fye will read a message concerning this meeting being held remotely.
Thank you, Richard. This is David Fye, Executive Director for the Kansas Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. 3 individuals have been provided time for public comment tonight, and they are including Dr. Brendan Clark, Melissa Provines, and then Jason Malosek. And so they are listed and will be providing public comment later in the meeting. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. Therefore, we will be conducting this meeting pursuant to the KOMA. On June 23rd, 2025, we sent notice of the advisory committee meeting to all individuals who had requested time or public notice of meeting. The notice is also posted on the board's website at ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may send an email to the BSRB main email at bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And I did check the conference call line before we got started. There's no one currently on the line, but if I hear someone beep over and introduce themselves, I will let you know.
Thank you, David. And this meeting is now called to order, and the advisory committee will begin its discussion of the first item on the agenda, and that is possible modifications to the agenda. Hopefully everyone has had a chance to review the agenda for today. Is there any discussion on any modifications to the agenda? Seeing none, I'll take a motion to approve the agenda as submitted.
So moved.
David Stevens moves. Do I have a second?
Second.
Jay Middleton seconds. All those in favor, please by signifying by saying aye.
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 Those opposed, same sign. The motion carries. And the next item on our agenda is to welcome our new advisory committee members, and they're listed here in alphabetical order. First, we can have a bit of a discussion on, well, you can give a little bit of information about yourself, where you are in the state, and what you do. And we'll start with Dr. Jennifer Fontaine.
Good evening. I'm Jennifer Fontaine. I am a psychologist here in Kansas City, Missouri. I currently work as a program manager at the Eastern Kansas VA in Leavenworth and Topeka, Kansas. Moved back to Kansas City, my hometown, about 2 years ago from Colorado, where I've been a licensed psychologist since 2002.
Wonderful. Well, welcome to you. Welcome to you this evening. And we now have Robert Twillman.
And you may call me Bob, please. I'm I live in Lenexa. I work at St. Luke's Health System in Kansas City, Missouri. I'm the manager for psychology services. I have 26 direct reports, licensed clinical social workers, licensed professional counselors, psychologists, psychometrists, all under my purview.
Welcome to you this evening, Bob. We're glad to have you both here. And I thought that we would all go around and introduce ourselves and again say a little bit about what you do and where you are in the state. And I can begin. I'm Richard Nobles. I'm chair of the advisory committee. I currently work at KU Med, and I'm in the neurology department, and I work with those who have sustained a concussion. And I'm in South Overland Park, but work in KCK. So I think we can go around in terms of who I see on the screen, and the person to my immediate right is Christopher Leonard.
All right, yeah, my name's Christopher Leonard. You can call me Chris. I am a licensed psychologist. I live and reside in Wichita, Kansas. I am the director of counseling and psychological services at Wichita State University. We have a variety of clinicians as well, that are social workers, professional counselors, as well as we train psychology, train social work, and train professional counselors too. So wonderful to meet y'all.
Thank you, Chris. Next, I see Jay.
Yeah, I'm Jay Middleton. I live and work in Southeast Kansas in Pittsburgh. I have a focus on psychological assessment and testing, work with government agencies, conducting disability assessments, vocational rehab assessments, conduct some therapy, mostly online. And super excited to have you all join us. This is a wonderful process.
Thank you, Jay. Much appreciated. Sarah.
Hi, I'm Sarah Kirk, and I'm a psychologist at the University of Kansas. I'm the director of the KU Psychological Clinic. It's a training clinic in the PhD clinical program. And then I'm also the associate DCT. I supervise students, teach some clinical courses, and I was once a graduate student under Dr. Twillman's supervision at the Cancer Center at KUMC. Fun fact.
Thank you, Sarah. And how lovely of a reunion. Um, David Stevens.
I'm David Stevens. I'm a public member of the BSRB. I'm a health attorney at a Kansas City health IT company.
Thank you, David. Jessica.
Hi, I'm Jessica Hamilton. I'm a licensed psychologist at the University of Kansas Medical Center, and I'm currently the director of our psychodiagnostic evaluation for medical interventions program and a clinical health psychologist.
Thank you, Jessica. And Tiffany.
Hello, I'm Tiffany. I heard someone from Colorado. I'm originally from Colorado myself. I live in Olathe right now. I'm working as a psychologist and training director at Osawatomie State Hospital. And I work primarily with our forensic program as well as training students and supervising.
Thank you, Tiffany. And Ned was here, but it seems like oh,
I'm back.
there you are.
Usually I don't go by Ned Who, but I have a new computer and I'm trying to figure out how the heck to get it changed. But anyway, I'm Ned Hunter. That's what people call me. That's the nickname for Edward, which is what usually shows up on my screen. And I'm at KU Medical Center, as are others. No Bob Twillman, by the way. He was with us for quite a number of years before he jumped ship. I'm the director of training in the Division of Psychology here in Department of Psychiatry and Behavioral Sciences.
Thank you, Ned. Much appreciated. So now I'll turn it back over to Dave Fye. He's going to give a little bit of an introduction on expectations of members of the committee.
And thank you, Richard. Yes. So welcome new members. Some of you, we've communicated over email, but it's nice to actually be able to put a face to a name and meet you electronically like this. And so we will have a annual training for all members of the advisory committee and also all board members, but we will take care of that a little bit later in about a month or so. The training that we go through will talk about some of the differences that you may not have encountered if you haven't worked for a state agency or a committee that is subject to the same rules as a state agency. So in your work as an advisory committee member, your main role is to assist the board, the Behavioral Sciences Regulatory Board, and to make sure that the board works in the most efficient way possible. The BSRB has 7 standing advisory committees, one for each of the 7 professions regulated by the board. And so the work that you do on these advisory committees is really important because it allows the board to collect the feedback and the thoughts and the comments of licensed professionals such as yourself to talk about different issues and then refer those recommendations through the chair of your advisory committee back to the board for official action. So the limitation on your work as an advisory committee member is that you are limited to making recommendations, but that is passed along, and then ultimately the board will have the authority to take official action or not. But like I said, your job is really important, and we really appreciate the 50 to 60 volunteers that serve on the different advisory committees that assist the board. One thing that in terms of different requirements or laws that we have to make sure we're mindful of, one of those I mentioned during the introductory information when we started this meeting, and that is the Kansas Open Meetings Act. So if you're not familiar with some of the laws around state agencies, if you have a majority of members of the board or a subset of the board, such as the advisory committee, you have a majority of members of the committee, there is interactive discussion back and forth, and it involves topics that are germane to the work on the advisory committee. Those discussions really need to happen in a public meeting. And that could be things like a conversation in person. It could be a Zoom meeting like we're doing today. It could even be something over email. But as long as there's that back and forth component, it really should happen during a public meeting. And so if you are used to other committees that didn't have that requirement, you may be used to groups that said, let's all work on things outside of the meetings, we'll work together, and then we'll bring it to the meeting, and then we can take care of what needs to be taken care of at the official meeting. This is a little bit different. So you're going to be limited on how much you can do outside of meetings, but that doesn't mean that you have to be on an island. So if you ever have questions, you can always reach out to myself. You could also reach out to the chair of the advisory committee, Richard Nobles, or David Stevens, who serves as a public member on the advisory committee, or the other psychologist on the board, and that's Linda Heisman Powell. So feel free to reach out to us if you have questions. We'll help you get situated in your new role as an advisory committee member. And we'll take care of the official things. So when we do have an official meeting, we'll provide the notice of those meetings. We'll make sure that documents and other materials that you'll use for meetings like this are posted on the BSRB website. And we always broadcast these meetings on the BSRB YouTube channel too. So we really try to get a lot of access to this information. And then the other main rule I want to make you aware of is the Kansas Open Records Act. And so you are all professionals, and so you may not need a reminder about this, but I always try to remind everybody at least once a year. People are used to records being things like official letters or documents, but even something like an email could be considered a record in certain contexts. So just be mindful of that your communications as an advisory committee member could potentially be subject to an open records request. So just make sure that you're always staying professional. And if there's any question about, making sure you're meeting the expectations of the rules and policies we have to follow, feel free to reach out. But we will have about an hour-long training. And in the past, we've done those at advisory committee meetings. The unfortunate thing about that is I'm essentially doing the same training 7 times, but also it kills about half of the time that one of your advisory committee meetings last. So as a way to be a little bit more efficient with my time and also with all of your time, what I'm going to try to do is set up about 4 opportunities for the annual training, and I will look at different days and different times And then I'll ask all board members and advisory committee members to sign up for one of those 4 sessions. It'll just be a little 1 hour. We'll try to fit those in different times that might work better for people. And that way, your advisory committee meetings, you can still do all the same work that you would normally be doing. So keep an eye out for that. We will do that with the full training. But in terms of other expectations, this is a great committee in terms of the discussion. So when you have materials that are sent to you, go ahead and read through those. If you have questions, ask us about those. Feel free to volunteer your thoughts and input at these meetings. The discussion is really valuable, and so I would encourage you to get invested and really enjoy your time as an advisory committee member. In terms of attendance, we really want members to attend as many meetings as possible. We understand there may be conflicts here and there, but I would really encourage you as much as possible. If you know of a meeting that's been set in the future, see if you can move things around to make sure that you're attending these meetings, so that way you can participate in the discussion and the recommendations for the committee. So I'll turn it back over to Richard, and if he has any other expectations for you as members, he can weigh in as well.
Oh, thank you, David. And I just want to echo a couple of the sentiments that Dave mentioned. One, please do reach out to any of us, whether it be Dave or me or David Stevens or Linda, if you have any questions or concerns about anything that has happened in a meeting or any questions about an upcoming meeting. We all are more than happy to answer any questions or field any concerns that you might have. And also the second thing I want to echo is that this is a really good group of people that is doing the work of protecting the public. And I enjoy my time in my role here. And I think that we have really robust discussions, and I think that we all work really hard to ensure that our regulations are up to date, or that we're up to date on advances in the field and how those advances interface with protecting the public. So I will encourage everyone, as you all have already done, to continue to do the work that we have been doing, and to continue to have really good discussions about our discipline. So thank you all again for your time serving on this committee. And once again, Jennifer and Bob, welcome to the committee. And I hope that over the next several months that you will have a good time in doing this work. So I'll move us on to public comment. 3 individuals have presented themselves for public comment. I'll ask that we limit our presentations to about 5 minutes. We can go a little bit over, and then we can also have any questions be answered or any comments for the individuals that have presented themselves for public comment. And first on the list is Dr. Brendan Clark, and he serves as the chair of the Department of Psychology at Wichita State University. Dr. Clark, the floor is yours.
Yes, thank you very much. I appreciate you giving me the chance to speak. When Chris Leonard mentioned to me that the board was considering removing the postdoc requirement, I then asked to speak at this meeting. My first job was at the University of Alabama, Birmingham, and Alabama is a state that does not require the year of postdoctoral training. And I didn't feel that psychologists in Alabama in the early part of their career were less equipped than the folks we have here. Additionally, at Wichita State, and I'm sure at other programs in the state, we have a lot of people enter our PhD program that got a master's degree, were licensed at the master's level, and then practiced for several years. So my student going out on internship this year, she practiced independently for 4 years before she entered the PhD program. So she's been doing this for a little over a decade. And I think, we can always benefit from more supervision, but there also comes a point of diminishing returns. And I think that the predoctoral training and internship training is very good. If you've ever been part of an American Psychological Association site visit, we pretty much have to document competencies across the board in therapy and assessment, and it needs to be internal supervisors. So we have a dedicated clinic director at Wichita State, and her entire job is just to supervise PhD students. We also do a peer supervision course that I teach, and it's going on for about 6 months now. And then we have to document external supervisors. So practicum sites in the community also have to document. If you have any questions, that's pretty much my spiel.
Anyone have any questions for Dr. Clark? And please jump right in. Seeing none, Dr. Clark, thank you so much for coming this evening. And if you wish to stick around for the rest of the public comment, you are more than happy to do so.
Okay.
Next, we have Dr. Jessica Provines, and she's the Assistant Vice President for Wellness at WSU, Wichita State University.
Hello, thank you all. First, I just want to express my appreciation for all that you do, volunteering your time to help support our profession in the state, and all that Leslie and David does to help. I know back in my days when I was the training director of WICPIP here in Wichita, Leslie and I had lots of emails back and forth trying to get these interns licensed. So thank you all very much. I serve as our Assistant Vice President for Wellness at Wichita State, and that means I'm fortunate enough to get to work with our counseling and psychological services and our student health department, as well as our health outreach. So we're really in the student services side, and we do a ton of training at the Student Wellness Center here at Wichita State. We have a licensed, accredited APA internship program that has been licensed since 1953, the first consortium in the country. And it is, I would say one of the strongest ways that we can recruit licensed psychologists to the workforce here in this part of the state. I myself am a graduate of Wichita State, and I completed our internship here. And I will say that it is very near and dear to my heart. Training future psychologists is a passion of mine. And so I do not want to diminish the training at all when I'm here to strongly advocate that we consider joining the multitude of other states who have followed APA's recommendation that came out the year I graduated in 2006, that we no longer need to have a postdoctoral year if we're meeting those training requirements during the year, which I believe we do. We have good training for our students. I moved into administration simply because I wanted to save our internship program. Sadly, I have seen the VA leave our internship program, the Wichita Child Guidance Center close its internship program, ComCare of Sedgwick County close its doctoral internship program, South Central Mental Health close its internship program, and we're currently concerned that Prairie View is going to be able to maintain the required supervision for the internship. I moved into administration because I know from an administrator standpoint, it is very difficult to justify the investment that it takes to hire an entry-level person and then to train them for that year of postdoc and then wait another 2 years before their post license where they can actually provide supervision in an internship program. So it would take us 3 years to get one of our doc interns trained and ready if we hired them and recruited them to work with us. 3 years for them to be able to contribute to our training program. By that time, we would lose them to the community in private practice. I am immensely afraid that we're going to continue to close internship programs, which are a pipeline for the workforce in our community, and we're going to see scholarship as a result fail. I know that Dr. Clark has had challenges hiring faculty, when we're seeing such demands and such a workforce crisis for behavioral health services, it is really hard. All of my colleagues have gone to private practice. And so those that are serving, that are educating, are struggling to keep our training programs, our academic programs going, our internships going. And those that are serving the underserved communities are struggling. So I really just encourage you, it would alleviate so much of my fears about closing our training program if I was able to hire my doc interns into entry-level psychologist positions, get them licensed and have them be part of the pipeline. That would make a world of difference, and I think really secure psychology in our state, which I am concerned about. We have expanded our training program to be multidisciplinary. We train professional counselors, we train social workers, and it's really hard to justify to administration the cost of maintaining the doctoral internship program when we're competing with other programs. We've also seen university counseling centers across the country close their training programs because they're experiencing similar things. So, this recommendation to remove the postdoctoral year from training came out in 2006. That was when I graduated, almost 20 years now. I think it's time for Kansas. I know that we all understand that we have a shortage in our state. And this, I think, would really help secure things. Not only that, but I think it would provide equitable pay for our PhD graduates who oftentimes in that year of postdoc are not making what some of their counterparts with a license at a master's level are able to do. So I also think it helps in that as well. And then just to speak on the quality of training. Our PhD students are among the best trained students that we train here in this center. And sometimes I'm forced to have to look at hiring someone who can be fully licensed versus someone who I know has better training just because of where we are with our staffing levels. So the training is quality, it's excellent. And I would really like to be able to retain and keep more of them. So I think that's everything I wanted to say. Let me make sure.
Well, I hate to wrap you up.
I'm out of time anyway.
But thank you. Thank you very much for coming and presenting to us. And please, if you would like to wait around for Dr. Malashek's comments, please do. And we'll also hold questions until the end of Dr. Malashek's. And please tell me, Jason, if I'm mispronouncing your last name. But
it is Miloshek. It's Miloshek.
Miloshek.
Not always so lucky with the last names.
Well, thank you for being here. I'll turn the mic over to you. This is Dr. Jason Miloshek. He is the president of the Kansas Psychological Association.
Past president. I'm the council representative of KPA and the federal advocacy coordinator. And I was the one that introduced this a while back to the advisory board. Just recognizing that neighboring states have done this in the past, they've been successful, and really all the things that Dr. Provines has suggested is earlier licensure, keeping psychologists close by after we train them instead of we train them and they leave. If you can keep that pipeline at internships, of course, you can keep more psychologists in the Kansas area. I know that community mental health centers have lost psychologists just because they can't afford them. Well, because they can't bill what a psychologist can bill for, like Jessica mentioned, for multiple years after they get done with their internship. So I have presented this before. I'm all for it. And I know the advisory board was leaning very positively to this. I'm more about, at this point, if you have questions or concerns, I would like to be able to address them as best as I can. I do know that a lot of states utilize, a lot of the information that we have is more dated. because we did have a bigger push when the APA brought out the Model Licensure Act and promoted that the postdoc year isn't necessary unless you want targeted expertise. So we have less data that is a little bit more relevant now. But I've been talking to MOPA, and they're the ones that have done this for a few years now. And they did have some just anecdotal evidence of hearing no more than regular complaints. And as licensed psychologists, we already are very low in the complaint levels. If you look statewide, we don't have a lot of complaints levied against us. And I'll attribute that to the amount of training that we do receive before we're licensed, even at the internship level. I also want to kind of consider, I don't know if this was brought up, but an intern, by the time they're done with the internship, has up to about 5,000 training hours. Adding another 2,000 to 2,500 isn't going to make them more efficient, isn't going to make them more ethical, isn't going to make them a better clinician. It might help them if they're targeting a specific population, or if they want to target neuropsychology and they want to get board certified, and more power to them there. The other aspect that I wanted to make sure I mentioned is that if we do this, we need to do our job as licensed psychologists telling students, interns, that getting supervision during their postdoc year, even if they're licensed, getting supervision is necessary in order for them to have mobility if they do want to go to a different state that doesn't have, that hasn't changed the requirement. We have to do a good job of that, because I don't want our students to get landlocked and stuck in a place because we haven't done our due diligence of saying it is important for you to get documented supervision that postdoc year, even though you're going to be licensed. So, and I don't think that's going to add more weight or business to a licensed psychologist if they only need to provide that 1 hour of supervision. I think it's very doable in order to still maintain the licensure requirements for other states. So I'm willing to answer questions as best I can, or to hear comments in either direction.
Any questions or comments for Doctors Provine and Maloshek?
I guess
I just wanted to, I'm sorry, Christopher. I just wanted to shout out, as somebody at the University of Kansas, I have a very similar opinion. We do such strong training, and I'm responsible for creating and tracking a lot of that. And we also get a lot of responses from internships about how well trained students from Kansas are. And I would love to keep more of them in our state. We also, as everyone has talked about, I have a real concern that the PhD programs aren't even going to be supported in higher ed if we don't have good evidence of job placement. That's one of the big metrics, which I'm sure Jessica is familiar with, that is very much being pushed right now by state legislatures. So we have to have evidence that we're employing individuals, and as soon as possible, given the investment they put in their education. And again, it's not just an economic argument. I think it's on every basis. They're well trained. They have tons of hours. I was kind of posed with doing some of that research, Richard, about kind of, do we have evidence? Similar to Jason, I don't think there's really good research evidence, but the qualitative data that has been collected all points in the same direction, which is that it doesn't have any major impact of adding that additional year in terms of negative outcomes. And again, that, I just don't see an argument for not restructuring it. And I would term it as restructuring, not that we're just getting rid of a year, because I don't think that's really proper. I think it's a restructuring, and people will continue to have the opportunity, as Jessica talked about, or Jason talked about, of having that additional training if preferred, and maybe in their best interest.
And all you're doing is you're identifying quality training at a pre-internship level. So you're still counting. What you're doing is you're counting something that hasn't been counted in the past. And so it will be up to programs to make sure that, especially in Kansas, that they have to make sure that practicum is well. And APA accredited programs already do this, and that their hours are supervised by psychologists. They're on site 60 to 20 hours a week. They're doing a lot of things. They're getting lots of supervision. And so that would be one of the things in making sure that our criteria, it still needs to be rigorous training. It still needs to be well supported and supervised. It's just we're counting a certain amount of I don't know what the number would be, but a certain amount of practicum hours, pre-internship practicum hours. And one last thing, sorry, Dr. Leonard. The economic, you know what? Economics is also equity here. That I want us to be very clear. I work at a university, and they are absolutely looking at our PsyD students and how much money they can make and when they can make it, because they are being asked by the federal government to be able to prove that I have a feeling that federal loans are going to get even more tunneled into. It's got to be for certain degrees or payback, or they already try to get universities on the hook for people who are defaulting on loans. If we add too much space between training and licensure, we're losing 2 to 3 years of equity when it comes to being a psychologist. We're not only going to lose people, we're going to lose people like, why am I doing this when I can go through a master's program and I can work right away and my loans are lower? Why am I paying for this? And so that's another thing. If we can encourage that you can get paid what you deserve during your postdoc year, you can be licensed. That's just another enticement to make sure that we have students who are really, really thinking, and federal government are really thinking, are universities giving what they're saying they're giving and making people have outlets to be able to pay their loans off and also be a part of our economy. Okay, now, Dr. Leonard, go ahead.
I think you might have answered a little bit of my statement, but I definitely want to open this up to all the guests. Are there any concerns or are there any thoughts that practicum supervision is not equal to postdoc supervision? Can you speak to that? How you might think that it's the same quality? If you do that.
Yeah, so I think developmentally it's quality supervision. They're not doing quality work yet, but that doesn't mean that they're not getting well supervised experiences. And they're getting a lot of it, not as much as internship, of course. Internship should be that culmination. But they are getting a wide variety, depending on what program, a wide variety of testing, intervention, sometimes even peer-to-peer supervision, lots of different things that they're getting as they grow developmentally. As long as they're being supervised by a licensed psychologist and it's structured, the amount of paperwork that I do to make sure our practicum students get what they need, it is so well structured and so well supervised. I supervise more practicum hours than I do internship hours, and that makes sense. But they're getting a lot of scrutiny. I vet them every single year to make sure that they're getting the same experience. I look at their hours every 90 days, making sure that they're getting rigorous hours, lots of supervision. So there could be concern there, but we would say that it's not going to count unless it was supervised by a licensed psychologist, and they're not doing psychological work. So that would be the thing, is like other states have put that the practicum has to meet those requirements, and one of them is licensed psychologist as the trainer. And every place that I send my students to, they have a licensed psychologist supervising them hourly supervision every week.
Yeah, I would.
So if I might interrupt very quickly, I would like to begin to wind down our discussion. I do want our guests to answer this question, and part of the reason why I'd like to do that is because some of what we're talking about will resurface towards the middle of the agenda, especially as we talk about point 9, and that's under old business when we talk about the survey report from licensees. There will be some. This is a recurrent theme of sorts in that discussion too. So please, Jessica, go ahead. I know that you were going to say something.
I just wanted to reiterate, we have found that our practicum experiences are very well trained. There's oftentimes an onboarding process where we're teaching, and then we're having close supervision with good communication with the academic programs and review of, live and audio recorded or video recorded sessions. My experience on postdoc is that is not the case. Oftentimes it is a perfunctory kind of check the box. I know when I was at a postdoc, I had lunch. What that was like a conversation, with just a colleague. It was not clinical supervision from what from my personal experience, and I've heard that from a lot of my peers as well.
Yeah, and I'll echo what Jason and Jess have said, that the quality of supervision and the volume of supervision that you get early in your career, the level of scrutiny and the amount of tape that's watched on the students, in my experience in talking with other psychologists, has been a much more strenuous early on than it is on postdoc, where postdoc is often you're going to take the psychologist at their word. You're not necessarily going to read through their tape and watch film on them and spend an hour a week. So I agree.
I really appreciate all of you coming to the committee this evening to present to us on what I think is a really timely issue and an important issue. And we will certainly be continuing this discussion over the course of the rest of the calendar year and maybe even into 2026. So thank you all very much for coming this evening. And you are more than welcome to come back to the committee if you want to answer questions or if you want to present more information. More than happy to have you back.
And thank you for having me too as well. I apologize for the hat and a t-shirt. I came right off the soccer field. My daughter had soccer, so I'm happy to jump on. And sorry if I was interrupting the meeting. So
No, absolutely.
okay. Well, thank you all.
Thank you. Appreciate
Thank
it.
you.
Mhm.
Good rest.
With that being said, I'll move us on to the next item on the agenda. That's item number 6, and that's the approval of the minutes from our last meeting on June 10th. I hope everyone has had a chance to review the minutes, and if there are any questions or any augmentations that would like to be made, I will open up the floor such that those can be made. Seeing none, I'll take a motion to approve the minutes from our last meeting on the 10th of June, 2025.
Move to approve the minutes.
Sarah moves. Do I have a second?
Second.
Chris seconds. All those in favor, please say aye.
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 All those opposed, same sign. The motion carries and the minutes are approved. And I'll move us on to our next item on the agenda, and that is the executive director report. Dave.
Right. Thank you, Richard. I'll go ahead and provide some updates on BSRB operations, some legislative updates, and also some items from the most recent board meeting. And so before I begin there, I'm going to switch my microphone. So just let me know if you can still hear me. Are you able to hear me now? Okay, great. So starting with some BSRB operations. First, I want to let you know that we received a positive comment recently. The BSRB website, one of the items we've worked on in the last year has been a transition over from our previous website hosted by a company called Sitefinity to a new website under Granicus. It was not an easy process. We've had our website for a number of years, and we needed to make some changes to make it a little more user friendly and make it easier for people with mobile devices to navigate to the important things. But it was still a little tricky to get away from something that we were attached to as we had worked to build the last website. But we've been really trying to make improvements and add more information for individuals and make it a little easier so that's not, it doesn't appear cluttered. So information can be found, but there's not too much information. So we were recently recognized by an article put out by the Association of State and Provincial Psychology Boards. They highlighted 10 agencies in an article that talked about user-friendly websites. And they had 2 different sections that they were praising the website for the BSRB. And so I just wanted to bring that to your attention. We actually used their news story and made a news story of our own. So that's on the website as well. So you can see a link to that article. But I thought it was a good analysis, and happy to, we were trying to do the best that we can, but it's nice when outside associations recognize that as well. So I wanted to pass that along to all of you. In terms of another operations update, at the last meeting, we talked a little bit about the board's agreement with a company called CE Broker. About a year ago, the board agreed to reach an agreement with that company to allow our licensees a free service through CE Broker.
what CE Broker does is they are a company that works with licensing boards to provide their licensees a way to upload documentation of continuing education hours, so that if you are selected for audit, if you have utilized that service and uploaded your hours, the licensing board can take a look at your hours in their portal, as opposed to you sending things back and forth to complete your audit to show that you did finish all of your hours. When we reached this agreement, one thing that was really important to the board was that this would be an optional service. No one was required to use CE Broker, but we did think it was beneficial. And the way that this company is able to do what they do is that there are some optional paid services. If individuals want a higher tier that would be a paid tier, it will provide some additional resources like connecting people to CEs and other things like that. So we wanted to make sure that no one had to pay money, no one had to utilize CE Broker, but everyone does have option to use a free account. And so we're encouraging them to do that. And if they pursue the paid account, that's a choice they can make. But we were curious how many people so far have opted into CE Broker. We've been using CE Broker for all of our agents or all of our professions since about January for anyone who wanted to optionally sign up. And so we met with representatives of CE Broker, and they indicated that between the free accounts and the paid accounts, so far about 1,600 of our licensees have signed up for services. So about 11% so far. What we have kind of learned through the discussions with them is that it seems like when individuals come up for their renewal, at that point, they have a conversation and decide whether they want to use CE Broker for this process or not. And for those that do, they have gone through the process to upload a number of hours at that time. So for individuals who are using CE Broker, if they're trying to upload 50 hours of documentation, that can take a little bit of time. What we're hoping is that as individuals choose to use CE Broker, perhaps they won't be doing all 50 hours uploaded at the same time. Maybe this will be a little bit at a time over the course of the 2 years, so that when they're reaching renewal, it will be a little easier of a process for them. And just to let you know, if you haven't utilized CE Broker, there is a way for you to assign hours to certain categories, such as ethics and diagnosis and treatment. So that way, if you are selected for audit right now, our license renewal specialist will send you a notice that says you're selected for audit. We need documentation that you've completed all of your CE hours for the last time period. And we ask, are you currently utilizing CE Broker? And if people are utilizing it, we will log into the portal to verify the hours. If they're not, there's just the regular method of sending the documents back and forth. Our ultimate goal is that we would like there to be a live link between the BSRB and CE Broker that would be part of the online renewal process. We would like people to be able to go through that renewal process, and then when they're looking at their continuing education hours, they could click a button in our system that would look over into CE Broker. And for people that are using CE Broker, it would say, based on what I have seen, it looks like you have all of your hours because I see that you've assigned them in these categories. Either way, it would allow people to advance through the renewal process, but it would be a live look. So if people are using it, they can see that the hours are uploaded. We're not quite there yet with our current licensing vendor. They've been reluctant to set up the API. So I think that may be something we set up through the new licensing vendor we're in the process of transitioning to, but that means that we're probably still about a year to a year and a half from having that be fully integrated. But in the meanwhile, we do want people to go ahead and begin to use the CE Broker services, and then we can continue to work on additional services through that company. We were also asking them questions as far as have people experienced problems. We asked how many help tickets their office has gone through. And I believe since January, they have had about 25 to 35 help tickets for licensees. The reason they have a few additional tickets is because we have a process in social work for individuals to become pre-approved providers of continuing education. And currently that is just for the social work profession, but we went ahead and had them build in the process for people to go ahead and register for that process for social work. So a few of the tickets are for those pre-approved providers for social work CEs, but the majority of the tickets were for licensees. But to me, that's a pretty good number given the 1,600 people who signed up for it. If there were only about 25 to 35 tickets, that's pretty good. But we do want people to know that if they are experiencing problems, maybe reach out to CE Broker first if it's a technical issue. If it is something related to our requirements, contact us and we can help someone out as far as that goes too. And we will continue to have more meetings with CE Broker. We're just looking to make it more customers friendly. We also received some feedback from some of the advisory committees last time that it may be a little difficult to find the information on CE Broker. When we first integrated the professions to have that be a tool, we sent something out to our licensees, and then we also posted a message on the BSRB website. But recently we heard that some people may not have access to that information as easily as they did before. So we have posted 7 new links to the CE Broker information, one on each of the professions pages. So if you were to go to the professions page on the BSRB website, look under the renewal section, there is now a new line with a live link for CE Broker information. So people can go ahead and access the information that way too. In terms of some other operations updates, we just finished the last of all of our surveys. That has been a major undertaking this year. You realize last fall we did the survey construction for most of the professions. The last group that we brought on board for the surveys was the social work profession, and that is our largest group of professionals. And we just closed a survey for them just a few weeks ago. There were 2,000 social workers that completed the survey. And so really happy with that response rate. It's about a 23 to 24% response rate on the voluntary survey. And that was about the average when you look across the professions. So we had a meeting with that advisory committee earlier today. The goal is now that we've surveyed all 7 professions, we will have an independent report for each profession, but also a comparison report across the professions. And so I think we're getting closer on having those established. So really excited about that. We should have some really good information, and really do thank everyone who completed the survey and was so generous with their time and their feedback, because we have a lot of good content as we'll go over later in the agenda. In terms of some legislative updates, I just wanted to make the committee aware of one committee meeting that the legislature had recently. So the legislature generally meets for about 90 days in the spring. And when they are not officially in session, there are some interim committee meetings that take place, and those focus on a number of different topics relevant to the legislature. One of those topics was a House Select Committee on Government Oversight, and this committee met on July 29th. And the focus of that meeting was a review of the operations of the Board of Nursing. And so we were actually contacted about a week before that meeting, and I received a legislative request for some information that had to do with our license renewal processes, our reinstatement processes, some of the just operations updates for the BSRB. And it's not unusual for me to get requests like that. But I never kind of heard back from anyone after I provided that. Well, at that meeting, they went through some of the processes for the Board of Nursing. And in the afternoon, there were a couple of speakers that spoke publicly at the microphone during the meeting. It's broadcast, and it was on their YouTube channel. And they were critical of some of the things that had occurred. A couple of the licensees had previously been licensed, and then through different circumstances, their licenses had expired. And there was at least a question of if they had practiced after their licenses had expired. And both individuals had worked out consent agreement orders with the board, and then had experienced issues related to those disciplinary findings. And so it got into a discussion about how regulatory boards are handling upcoming license expirations, whether it's an unprofessional conduct for someone to allow their license to expire. Is there proper notice going out from regulatory boards in terms of how to renew your license? Are there technical issues with the systems being used by state agencies? And so while the primary focus was on the Board of Nursing, there was a document provided to the committee that compared some of the practices for that agency to practices by the BSRB, practices by the Board of Healing Arts, the Board of Pharmacy, the Dental Board, so other smaller regulatory boards with a health connection. And so, I do think the committee might possibly meet again on similar topics. So we want to be mindful of what the legislature is focusing on as it relates to that. And also we want to be mindful of ways in which we can improve our own operations as well. I do think that some of the things that we have in place are helpful. We currently send out reminders to individuals If their license is going to expire, we send those out 90 days in advance, 60 days in advance, 30 days in advance. And then if someone's license does expire, we send them a message that says your license is now expired. And we clarify with them that it's not a violation for the license to be expired. That's perfectly fine. It's just, it's not permissible for someone to practice unless they have a valid license. And so we inform them that if they do want to provide services in the future, they will need to request that their license be reinstated, and there's a process for that. And so I think for at least one of the agencies that was discussed during the meeting, they sent a paper postcard, but they only sent emails if someone had opted into their system. And then I don't know that they sent the same sort of message when someone's license expired. So there was a question whether people knew their license was expired, and then the issues that were surrounding the circumstance. And so, so I think now there have been some questions as far as, is it unprofessional conduct if someone's license expired? And, for the BSRB, it's not. We have our licensees that allow their licenses to expire for one reason or another sometimes, but we try to make sure people are aware of the reinstatement process. And in fact, the board was able to pass something about 2 years ago to encourage people to come back to the professions. The current rules right now is that if your license expires, you would pay a reinstatement fee plus the renewal fee, and then show documentation that you had done all of your CE hours for one previous time period. But as a way to help motivate people to come back to the professions, if someone's license has been expired for more than a year, they are able to have their license be reinstated at half the cost. And so that was something the board did with intention to try to make it easier for people to come back to the profession. The board also added some flexibilities in the statute in terms of if someone was coming to the end of their expiration of license, and if there was an extreme reason why they couldn't do all of their CE hours, they were able to make a special request. And if they were approved for additional time to finish their CE hours, they would still need to renew their license by the expiration date, but they could be approved for up to 3 months of additional time solely to complete the hours. And this would be in rare situations where someone did have a health emergency or something like that. But we thought this would be a good way to help out with workforce to help keep more people licensed that otherwise would have let their license expire and then stop practicing. So, so the board has been really aggressive in the last few years at addressing a lot of these workforce concerns. But now that the focus is on expiration and renewal and reinstatement, I just want to make you aware what our policies are, but also we're paying attention to what the legislature is focusing on. And if we do have recommendations, we'll bring them back to you. So before I talk about items from the last board meeting, I'll pause here and see if there's any questions about that meeting or anything else related to legislative activity.
I just want to say thank you so much for attending the meeting, the hearing, and I certainly look forward to hearing updates about this matter in particular, because I know that the BSRB is always working towards uh, making sure that its licensees are apprised of information, and the BSRB is always trying to streamline processes so that people aren't caught off guard if their license, for example, if their license expires. So I appreciate you going, and I look forward to more updates.
Thanks, Richard. And yeah, these are important conversations, and I want to make you aware that they are taking place. If anyone does want to go back and watch that meeting, I did think that it was really informative and very interesting in terms of the discussion and the questions the legislature asked. So again, that meeting was on July 29th. It was the House Select Committee on government oversight. And if you are not familiar with the legislature's YouTube channel, they do broadcast all their meetings during the legislative session and during the interim. And you can go and take a look at that. But I just want to bring that one to your attention. So, and before I wrap up my report, I'll just make a couple of notes about the most recent board meeting. The most recent meeting was on July 28th. And at that meeting, there were a number of new advisory committee members that were appointed to different committees. A couple of the other committees will still be making recommendations this month, but one of the other topics the board was working on was going through the review of the unprofessional conduct regulations. You did a number of good recommendations in terms of reviewing the unprofessional conduct regulations and forwarding those recommendations to the board for consideration. The other advisory committees did the same. Now, what we have done as a staff is put together the recommendations for all the advisory committees by doing a side-by-side comparison to the existing language or the recommended changes to the language for each item in all of the unprofessional conduct regulations. So this was a massive undertaking. It is a giant spreadsheet grid, but it is posted on the board's website and you can take a look. And it is really interesting to see side by side some of the different wording choices for things like undue influence or dual relationships or confidentiality. And the board is working really hard at these meetings, going item by item, having a discussion about should there be uniformity in language or are there reasons why there needs to be some differences between the professions. And so you all spend a lot of time, and I want you to know that your work was not forgotten. The board is taking time to do this to make sure we put these changes in the right way. But I do compliment the work of the board because the board has been very active in their discussions and really putting in a lot of well thought into these proposed changes. And I think probably by about the end of this calendar year, I think we'll be close to having all the recommended changes reviewed and perhaps getting close to be putting those out for public comment. So the last big takeaway from the board meeting, a few years back, there was a bill that was passed that authorized the board to be able to require background checks for licensure. It didn't say that these were going to be required, but it allowed the board to make that determination if the board decided that was something that was necessary. And I know the board has been weighing different factors recently. One of those is the public protection mission of the board and making sure that licensees or that the public is protected. But there's also the factor of workforce and fees and different things like that. So it is a difficult conversation. But recently, the state of Kansas has added 3 professions regulated by the BSRB to multi-state compacts. There was SIPAC for psychologists, professional counseling, and then most recently social work. And each of those multi-state compacts sets into place a minimum threshold, and each of those 3 requires background checks. In our surrounding states, their license requirements all include background checks. And so ultimately, the board revisited that conversation. The board decided that it was important to go ahead and begin to require background checks for licensing. We are working through the logistics of how that will be implemented. The authorizing statute allows the board to do that for individuals upon application for initial licensure, also for reinstatement, and then also if there is anything related to an investigation by the board as well. We are seeking clarity to see if there is a way for people to opt in for a background check to make sure that they are eligible for multi-state compacts. And so that is something we want to make available to individuals as well, which would be supplemental to their review for licensure, essentially. So we're working on the details of that. We will definitely have more information on that for all of you. Just for your information, for the SIPAC multi-state compact, while that did require multi-state or background checks for that compact, the language said there would be a certain window of time established by the commission for states to come into compliance with that. And the time period was 10 years. So we had plenty of time to get this underway. But some of the other compacts have taken the position that if someone has not done a background check, they would be ineligible to practice under the compact. So we want to make sure that our licensees are eligible. And so that is why we revisited this and had the board, they were encouraged to make that determination. And so just want to make sure that you are aware that is taking place. And we'll have more details when we have worked out the logistics for that. But I've had active conversations with the KBI. It sounds like the price of the background check is about $57, and that entire amount would go to the KBI as a pass-through just for the purpose of doing the background check. We may have an impact for the BSRB if we find more items through these background checks that will probably lead to more investigations, but that goes towards the public protection mission of the board. We have a duty to investigate those items when we find them. So that may impact how many investigations we do per year, which could potentially affect our staffing or utilization of people in different roles, but we will only know that once we get into it and start to review those background checks. So I'll go ahead and end my report here and see if there's any questions on any of the topics that I discussed or anything else.
Any questions or any feedback, any comments? Seeing none, thank you very much, Jay, for your report. I'll move us on to item number 8, and that's an update on the SIPAC Multi-State Compact. I was in attendance at the mid-year meeting on the 14th of July, 2025, that was held virtually. And a number of matters were discussed at the meeting. I'll just go through a few things briefly. One, received numbers about how many psychologists are practicing under SIPAC, and there are 16th, and this is nationwide, there are 16,950 or so psychologists that are practicing under SIPAC, and that's primarily the APIT, the not when you're practicing via telehealth and not practicing via in person. So there are nearly 17,000 psychologists that are that have a not a license, but the word is escaping me right now. That have the privilege. There we are. That have the privilege of practicing under SIPAC. Currently in the state of Kansas, there are about 120. Dave and I did a calculation just this afternoon to determine how many psychologists that identify Kansas as their home state, because you have to identify a home state when practicing under SIPAC. There are about 120, 119 that are practicing via telehealth, and there are 11 that are practicing using their in-person privilege. That's about 10% of psychologists when it comes to those that are practicing in via telehealth, and about 1% of psychologists that identify Kansas as a home state that are practicing with in-person privileges under SIPAC. We talked a bit about the states that are onboarding with SIPAC, that are joining the compact. There are 43 states that are on board now, and there are hopefully going to be a few more coming up here in the next year. New York has started its process of joining, so that will be another large state that will allow for its psychologists to practice under SIPAC. We had a discussion regarding the finances of SIPAC. SIPAC is financially sound, and it has a strategic plan to continue its investments so that it can remain financially sound. I was asked to serve on a committee to review the bylaws and the rules and regulations across SIPAC to make sure that those matters are syncing up. There are a lot of, from what I understand, there are a number of inconsistencies with respect to language across the regulating documents of SIPAC, and I have agreed to join the committee to analyze those documents so that those can become more consistent in how it's worded, and so that there isn't clashing of regulations across the documents. I think that those are the big takeaways, with the exception of point B, and Dave and I are going to go through that here momentarily, but I do want to know if there are any questions about the mid-year meeting. And the one last thing, the annual meeting will be held this year in mid-November, and I'll be in attendance there, and that is in person. That'll be in Tucson, Arizona. Any questions? I'll move us on to the second half of this matter, and there were proposed rule revisions for that are available for public comment. And Dave, I'll have you introduce this, and I will backfill and further explain as needed.
Okay. Well, thank you, Richard. And again, really appreciate you serving as the commissioner for the SIPAC Commission and having attended the mid-year meeting and getting involved in the committees. Really, thank you for representing the state in that capacity. There were 2 proposed rules from those meetings, and they are similar in some ways. So as Richard talked about, the primary way that people are practicing under SIPAC authority has to do with the authorization to practice interjurisdictional telepsychology, or the APIT, although there is also the TAP, as what it's called, when you're providing up to 30 days of in-person services in compact states per year. The two rules that are out for public comment, or proposed rules that are out for public comment now, the reason I mentioned they're similar is because one of them is a set of potential changes that would relate to the APIT, and then the other one is a set of the same potential changes that would relate to the TAP, because there's a certain different section for each one of those. So I thought I'd share my screen and just kind of show what the changes are in the proposed rule. So I'll share my screen. I may not be able to see you all once I'm sharing my screen. So if you do have comments, feel free to just interject by sharing your thoughts. So you should be able to see here the document that has the proposed rule for the SIPAC Commission. Some of the changes here are reflected in red, and so some of them just deal with language. But one of the items for the new proposed rule would be under section 4.3, qualifications for authority to practice interjurisdictional telepsychology. A new rule that is proposed in terms of the language would say, to be eligible for an APIT, an applicant must have successfully completed a graduate course of study with a minimum of 1 academic year of in-person, face-to-face instruction at the educational institution, semesters, terms, and other academic periods in which the student completed only distance or remote instruction, whether synchronous or asynchronous, will not count towards fulfillment of the in-person, face-to-face instructional requirement. And I'll come back to that language, but I'll show you what the other modifications are that are in the proposed rule. Another is changing the reference to the website as a .gov instead of a .org. A lot of the compacts received approval to do that and are regarded as governmental entities. And then there is also a new section that talks about grounds for application denial. So there has been a way that individuals could apply for the authorization to practice and be denied, but there is new language which specifies the grounds for application denial, and it says an authority to practice interjurisdictional telepsychology or APIT authorization may be denied if the applicant does not meet the requirements for the authorization and or there is sufficient evidence that the applicant has engaged in acts, including but not limited to the following: fraud or deception in applying or renewing an APIT or TAP, misrepresentation of APIT and or TAP status, practicing with an expired APIT or a TAP, notification of adverse or disciplinary action by a psychology regulatory entity, and violation of APIT and or TAP acknowledgements. Further, it says failure to provide requested information to the commission in the specified time frame, failure to comply with SIPAC commission rules and or policies, or receiving any other adverse or disciplinary action. There's also a new section 4.14, grounds for revocation. An APIT authorization may be revoked by the SIPAC staff or the requirements review committee whenever the staff or committee has sufficient evidence that the APIT holder has engaged in acts including but not limited to the following: fraud or deception in applying for either of those authorizations, misrepresentations of the status, practicing with an expired authorization, notification of adverse or disciplinary action by a psychology regulatory entity, violation of the authorization acknowledgements, failure to provide requested information to the commission in the specified time frame, failure to comply with SIPAC commission rules and or policies, or receiving any other adverse or disciplinary action. And then there is a section here that was previously in there on the appeals process, but some language is being struck that says applicants who are denied authorization and or authorization have been suspended or terminated may file an appeal pursuant to policy 1.20 and 1.21 by submitting the appropriate form to the SIPAC commission. And instead, that is replaced with a new section 4.15 that talks about the appeals process in more detail and says once the denial has been issued, SIPAC staff will provide the applicant with written notice of any grounds for denial, along with an appeals form and deadline for appealing the decision. The applicant shall have 30 days from the date of the notice to request an appeal. If no appeal is filed in a timely manner, the action is final. If the appeal is filed in a timely manner, it will be heard by the appeals committee as soon as practicable. The appeals committee shall issue a decision on the appeal, which shall be final. Once a revocation has been issued, SIPAC staff will provide the authorization holder with written notice of the grounds for the revocation, along with an appeals form and deadline for appealing the decision. The authorization holder shall have 30 days from the date of the notice to request an appeal. If no appeal is filed in a timely manner, then the action is final. If the appeal is filed in a timely manner, then the appeal will be heard by the appeals committee as soon as practicable. The appeals committee shall issue a decision on the appeal, which shall be final. And a copy of these rules are also posted on the BSRB website, but I just kind of wanted to walk through that for you so you would know the different components of the proposed rule. The deadline for any individual to provide comment back to the SIPAC Commission is October 3rd, 2025. But in our conversations, I did want to revisit that first item. Richard and I had discussed that item.
May I make one quick comment? And also, so these rules are for the APIT. There's these rules, excuse me, these revisions are for the APIT. These revisions are duplicated essentially for a rule revision for the TAP, for the temporary authorization to practice. So that's under Rule 5. These are under Rule 4. And Dave, I'll have you go back to the first revision that we had discussed.
Yeah, I definitely wanted to make sure that you were all aware of these. I know not everyone here may be practicing under SIPAC, but as we are a member of the compact, some of the work of the advisory committee could be to help inform the board of any thoughts regarding some of these types of issues. I thought it was interesting in reviewing the language of this item. It is similar to some of the recent language the advisory committee had considered regarding whether it was necessary for someone to have received their education at the physical location of an institution. There is some specific language here which talks about having a minimum of 1 academic year of in-person, face-to-face instruction at the educational institution, which is the current language in our regulation, but there was a recommendation to change that to allow for some additional flexibility, to allow the in-person requirement to be met, but for those schools that don't have a campus or don't have a facility, the question is, how could they meet that requirement? And so just kind of wanted to bring that to your attention. So I will open it up to each of you if you have any questions or if you have thoughts or any discussion items about these proposed rules.
I think that this particular matter is really important to discuss because, as Dave said, we essentially have gone in a different direction as of late with respect to educational requirements and it being at an institution, being in person at an institution. So I would certainly welcome thoughts, comments, or questions regarding the proposed rule change, all of them, and especially that one. Seeing none for now, Dave and I had talked about whether the advisory committee would want to have a recommendation made to the board with respect to the BSRB, making an indication one way or another about the rule changes. So these will be voted upon later on in the year at the annual meeting. I will be a voting member, and I would want to know if there are thoughts one way or another about a recommendation as to whether or not you would want for me as your representative to SIPAC as the commissioner to one way or another in terms of how you would like for me to level of vote.
I think it would be smart for us to align with the proposed change that we made. I know that's still in the process of going through. But if that's the direction we're moving in, I think that makes more sense to me.
Well, thank you, Chris.
I'm seconding that. I'm in agreement of kind of us moving in the same direction as the proposed changes.
So the changes that the BSRB has made, or the changes that SIPAC is making? Because if it's in the direction that SIPAC is making, then that does clash with the changes at the BSRB, the regulatory changes that we have recommended to be made.
And so my thought is that for Kansas providers to practice under SIPAC, that we probably should move in alignment with them when reasonable. And so perhaps that does clash with the proposed changes.
And just food for thought. I don't really have a vote necessarily in terms of advisory committee recommendations, but as a procedural thing to consider, it could be something also that you could consider making a recommendation to potentially divide this question when it comes up for vote, because I do feel like there are a lot of different pieces of this proposed rule, and I feel like some of these are textual cleanup. Some of them have to do with providing more clarity in terms of the revocation process or the appeal process. And then sort of also included in there is this language about the requirements for education. So, one thing you also could do as far as a recommendation may be to divide this rule when it comes to vote. So that way you can identify people who may also share concerns about the educational language versus all the other components in these proposed rules.
And I'm more than happy to have offline discussions with any of you regarding the proposed changes, whether it be those related to revocation or the appeals process or the educational requirement that's being proposed in rules 4 and 5.
Yeah, I just have a question. I think it's more for David. So just procedurally, when you're asking about that possibility, like you said, there's just a lot packed into this. And if one has a concern with one element, but none of the rest. So procedurally, when the BSRB votes, can they agree to vote on part of it, but not the other? Do they table it in that kind of instance? What happens?
And this is maybe for Richard to kind of to field, but I'll share my comments from when I was previous commissioner. It seems like this would be something that I think when I was commissioner, the SIPAC commission really felt like they would have been open to maybe splitting this when it came to a vote. And so if this was something that had come through in the past, given that these are totally different subjects, even that may be a nice way to start the conversation. And so potentially a recommendation to the board of the BSRB could be, recommending that it be split to identify, the items that you would want to make a recommendation on specifically based on the content. And then after a procedural type thing, you could make an additional recommendation as well. So because if it's not split, then you're in a difficult position, which kind of the legislature puts people in, or sometimes they're put in themselves, where you have to say all to yes or all to no. But I feel like in this, I don't see a reason why they would want to tie their hands that way. So,
and I'm reviewing this, and it is kind of how does this work with hybrid programs? Because it says must have successfully completed 1 year academic in-person face-to-face instruction. Is that for all courses, or is that if you take one remote class and everything else is in person, does that negate that? Or is it, and do they define an educational institution as online, or does it have to be physical like the one that we changed?
So
I know here, we've talked about this a lot because there are APA requirements, and also not even at the APA, but also with regional and university accreditation processes, you have to very, very distinctly define online programs. And like you said, Christopher, it's really not about like if you allow students to take one online course or, you know, one tele process. They really have to be very tightly defined. So I would agree though with Christopher, like this just seems a little looser, I guess, in terms of the way it's phrased. I don't necessarily have a problem with that, but it does beg the question that Christopher brought up.
And
Like we're identified as an in-person program, for example, you know, our PhD program, not an online program. And it's not like it's a mix, but we do have to identify and describe if we teach anything online. And it can't go beyond a particular number of courses or credit hours.
Dave and I had again a discussion about this, and we asked each other similar questions about what certain phrases mean, and I think that what will be important for me to do at the annual meeting in November is to bring these same questions up to the wider body of commissioners. I think it's especially important when it comes to defining what in person means in this instance.
And Richard, I saw another one go by, and the grounds for revocation.
Hmm.
Last item is pretty vague. It's something about any other adverse action. I don't know what that means. Who is taking the action? It's really vague, and I think needs some clarification.
Thank you, Bob, because I had not thought about that. Dave and I were so focused on the first one because of the implications that it has on the way in which we have framed things in our regulations that I did not it did not capture my attention the same way that that item did. So thank you for pointing that out. And that's pretty broad in its wording.
Yeah, and it feels weird to call you Bob, but you did say to call you Bob. The SIPAC compact, it does have a very strict line when you're looking at disciplinary violations. Some of the other compacts basically have some different language that look to see, are you current under discipline from your home jurisdiction? For example, if you were under, let's say, a CAO for supervision or something, while that remained in place, I think for some of the other compacts, you would be ineligible. But then once you had satisfied the terms of your order, you would no longer be under those conditions. The SIPAC language, if I recall correctly, I believe it's written very, very stringent. And so if you have a history of any disciplinary violation, I believe you're ineligible for the compact. And I, at least that is true with your home state. I am not 100% sure if that is, you know, if you're doing telehealth and you practice into a remote state and the remote state determines it's a violation, they might have the authority to say you can no longer practice into this remote state. But at least with your home state, I think if there's any violation, that would be a disqualifier. But I think back to your point, if it does just say any disciplinary violation and it doesn't say determined by your home state, then potentially it could be broadening the authority of what might disqualify you if it is something from the remote state. So that might need some additional clarifying language.
Yeah, that list had it as an earlier item, action by your own licensing board, and so this is a separate item from that, and who knows who they're talking about? It could be an insurance company, who knows?
And there has been some discussion about, you know, unprofessional conduct regulations are not uniform one state to another. They were determined by the individuals associated with the licensing boards in different states or by the state legislature, sometimes influenced by different associations. And so what may be unprofessional conduct in one state may not be in another state. So one state could reasonably find something to be unprofessional conduct that is simply not unprofessional conduct in a different state. So that can lead to some potential issues at times.
Any other questions or thoughts or comments on the proposed rule revisions? Again, everyone has until the 3rd of October 2025 to make any public comments should they wish to make them. And please do, again, send me messages or send messages to Dave regarding any of the matters that we've discussed with respect to the rule changes. The annual meeting is November 16th and 17th, so we have a little bit of time between now and then, but I certainly would want to hear any feedback previous to my departure to Tucson.
By the way, I just want to add one more comment since we have new advisory committee members. If you do wish to provide public comment, it is okay to identify yourself as a member of the advisory committee. You just want to make sure that you don't put yourself out there as speaking for the advisory committee, and definitely not that you would be speaking for the board of the BSRB. That's just something that we include in the training, but since you haven't had the full training yet, I just kind of wanted to let you know that it's always okay to talk about what groups you're a member of. Just you want to be very careful to clarify that you're speaking individually if you do provide comment, not speaking on behalf of a larger group.
Thank you all. I really appreciate the discussion on this. We have 25 minutes left. There are 5 items on the agenda between old business and new business, and there's a discussion or a potential discussion about upcoming meetings. Dave, is there anything under new business that we should tackle that would be a short period of time such that we can get back to old business, especially under point A, because members uh, were given uh, readings to peruse, and I know that can take a significant amount of time, especially with the comments that were made with respect to the survey report. So anything that you would want to cover under new business before we get to old business and we can wrap our discussion for the evening.
Yes, and so on topic A under new business, Dr. Mark Goodman had to step off of the advisory committee, but we did really enjoy working with him as a member of the advisory committee and appreciate all the work that he did. But with him coming off the advisory committee, that does mean that there will be one additional opening on the advisory committee. And I was talking with Richard about this. And it would be his preference that the advisory committee would continue to review applicants and potentially make recommendations on adding a new member at the next meeting. And so we have a couple of new individuals here who have not had the opportunity to review the letters that were submitted by individuals wishing to be added to the advisory committee. So we thought this would be a good opportunity to just make the entire committee aware that there would be one additional opening, and then we will redistribute the materials that we had already collected for applicants for the advisory committee to you so that you can be prepared to discuss thoughts and recommendations on a potential new member to the committee at your next meeting.
Any questions regarding new membership to the advisory committee? I too want to just thank Mark for his service on the committee, and we wish him well. Anything else under old business? Do you want to discuss the alternative pathways to licensure, or shall we go back to old business?
Under the alternative pathways to licensure, I'll just frame this for the new members of the advisory committee. This was something that was referred to the advisory committee by the chair of the board. The chair of the board brought up this topic broadly for all the professions and just asked each of the professions to have a conversation about this, specifically looking at alternate pathways to licensure that may not involve passage of a licensing examination. This does not mean that your advisory committee needs to recommend that that is something that should be a change, or that there should be an alternate pathway to licensure that doesn't include that. But as a discussion topic, he wanted each of the advisory committees to discuss that, as topics are sometimes referred to the advisory committees. But I wanted to make sure that you all were having an informed conversation on this topic. So I did reach out to the Association of State and Provincial Psychology Boards, ASPPB, and they keep track of license requirements in different states and jurisdictions and provinces. And I was able to pull some information from their document. And if you wanted to check this out, this is at ASPPB Center it's spelled CENTRE.org. So ASPPB Center, but CENTRE.org. And there's a number of different sections that talk about licensing requirements in different places. And one of the headings was, is the EPPP required to become licensed? And I was able to just pull that information for, I believe, all the US states and territories. Now, some of them did not respond back when they were collecting information for this. So there's not information for Virginia, Puerto Rico, New Hampshire, New Jersey, Maine, Indiana, Guam, and District of Columbia. But all of the other states, provinces, and territories that provided information, the answer to that was yes. So every jurisdiction that responded to the SciBook survey does require passage of a licensing examination for licensure. So I did want to provide that to you because that is some of the information I was able to gather. I'm trying to collect that for each of the professions so they can be aware, are there trends? Are there things that other states or provinces or territories have considered? So I'll continue to look and see if there's other information out there, but at least based on my preliminary research, I don't see a jurisdiction yet that would have an alternate path for PhD level licensed psychologists that would not require passage of a licensing examination.
Any questions for Dave regarding that matter, alternative pathways to licensure? Thank you for updating us on that. I know that Dave Anderson, the chair of the BSRB, has tasked all of us, all of the committees to do to make this inquiry. So I appreciate you doing this work. I'll turn us back to old business, and I will have us begin a discussion around point A, and then we can pick this back up in our next advisory committee. And point A can, I think, have some overlaps with point B, and it does have some overlaps with point C, but we'll discuss those separately. Dave, I'll turn it back over to you to frame our discussion.
All right, thank you, Richard. And so for those of you that are new to the advisory committee, we talked about doing a survey for all licensees and providing the advisory committees with drafts of the survey responses. We tried to summarize some of the information, but also in these reports, we included as much as possible the open-ended responses for the people that responded to the surveys. And to make this process a little bit more direct, we asked the advisory committees to focus on 2 specific questions to be discussed at this meeting. And so in your agenda, you can see the 2 different questions we asked individuals to focus on was practice-related negative issues, and then also any negative issues involving supervision. So to kind of set the stage for this discussion, I'll go ahead and share my screen here and just show you. I had staff members go through the responses and provide some summary information in the report, but I wanted to allow you all to have a discussion about these topics, and I hope you've had a chance to look through the open field responses as well. So let's just start with the summary information, and then I'll open it up to any thoughts that you have based on what you've reviewed so far. So again, this is in your packet of material. We're looking first at question 12, and this starts on page 8 of the report. Question 12 said, over the past 2 years, based on your observations and experience practicing in the psychology profession, could you share information on any practice-related negative issues you have seen, such as areas where practitioners appeared to need more continuing education or training in a certain area? And 223 licensed psychologists answered the question. 41 respondents indicated have experiencing no practice-related negative issues in the last 2 years. 11 responses centered on diversity training and continuing education hours. Specifically, the most frequently reported training needs are in the following areas: insurance, diagnostics, ASD and neurodivergence, trauma, evidence-based treatment, ethics, artificial intelligence, and also suicide prevention. While less frequently identified than the previous noted items, other licensees pointed out other practice-related negative issues concerning legal services. Other respondents indicated seeing concerns in the areas of trauma, master's level psychology, boundaries, testing, mandatory reporting, and care for youth. And concerns were also raised regarding psychologists supervising other professions. So I'll go ahead and stop sharing my screen here, and I'll turn it over to you, and feel free to discuss if you have any thoughts or comments based on what you've reviewed so far.
One area I would definitely comment on, and certainly I've talked to a lot of people across the state about this, is we are really seeing just a significant onslaught of requests for adult autism assessments. It's a high area of need and just a constant flow. And we don't have even close to the number of providers that can provide that service. And I think I've also went to some training sessions from some folks nationally about also the bridge between child and adolescent autism and adult services. And there's just really a lot of difficulties and challenges in that area as well. So I think it's multiplicative. There's lots of concerns. I can understand why that's made the top list. We do the best that we can as a training program, but it is a really challenging area to adequately train people in. And there's even argument about who should be doing that, especially if you don't have a lot of child-focused courses and training. So I just wanted to kind of just chime in that that's a pretty consistent source of, I guess, feedback that I get. And we do provide training and conduct those assessments, but we're one of about 3 places in the state of Kansas that does them, it seems that to me, and also in a cost-effective manner. So I agree that that is a real considerable issue right now.
And if I might dovetail off of that, Sarah, what you just said at the very end, it being doing it in a cost-effective way, it can be exorbitantly expensive, prohibitively expensive to have an assessment done to determine whether or not someone meets diagnostic criteria for autism. I mean, those assessments can be out of reach for a substantial percentage of the population, especially those who are on Medicaid state plans. That can be just, it's out of reach.
I don't have any solutions, but I do think it is a considerable problem right now. And it's not just here. I talk with folks across the nation and other training partners about this. It's everywhere. It's not just here. So.
Something that stood out for me in reviewing the responses were the concerns regarding diagnostic assessments, and not just, a full psychological assessment, but the training and the ability that practitioners have to make accurate diagnoses or differential diagnoses. There were a whole number of responses that strongly vocalized that it seems that practitioners are making even inappropriate diagnoses. So kind of going back to what Sarah was discussing, would it across the developmental time span, so whether it be children or adults, there were a whole number of comments regarding this, and the desire for there to be continuing education that that allows for people to learn more or to rehome their skills when it comes to diagnostic assessment.
And I think also, and I don't know, Christopher, or some of the other folks that are associated with training programs, one of the things we hear a lot as a training program from internships, and this kind of connects to our previous discussion about the postdoctoral year, and I know Ned would talk about this as well, is that more and more graduate programs aren't training and assessment and really digging into diagnostics as much. We still are doing that, but there definitely are a lot of folks that are reporting that they get trainees that just don't have that training as strong as they once did. So I do think it is an issue with training, and particularly in the area of assessment. And sometimes assessment is really necessary to do a comprehensive diagnostic, particularly if it's complex. You're sorting through ASD and other psychopathology, all sorts of learning issues. It can be quite difficult and challenging, and testing is just one of the things that you need. So I just want to comment on that, Richard. We are hearing that our training program is still doing all those things, but certainly across the country, people are reporting that trainees are coming out with less of that training.
And to that point, something that stood out from one of the responses was the psychologist indicated that it seems that programs are so focused on the acquisition of face-to-face hours as opposed to being focused on the report writing piece. So the integration and the interpretation and making distilled recommendations. And what the psychologist said was that they've seen reports that that reflect the there just seems to be less of a focus on the thing that psychologists do, and that is the heavy lifting of making of integrating information and analyzing information and delivering recommendations and results. Any other thoughts or anything that stood out for anyone else? I have a whole number of things that popped up in my reading of this when it came to continuing education and when it came to the desire for there to be more diversity training. That was also a pretty consistent theme, I think, in the responses that I read, and matters related to LMLPs and LCPs, licensed clinical psychotherapists. That was also, I think, something that was echoed throughout.
That really jumped out to me, was that issue. And not to get ahead of ourselves, but one of the concerns I know, and not to speak for you, Ned, speak up if I'm misspeaking, but there is a concern about reducing or adjusting the postdoc year would reduce competency. And one of the things, and I did this initially too, was pointed to this survey about concerns about trainees. And after reading it, certainly there are some concerns regarding assessment, but I found that much of the concerns about new supervisees and supervision and training were actually related, certainly not entirely, but largely to a lot of the master's level clinicians. People are training, again, not entirely, and I don't, but that in some ways, and again, not to get ahead of ourselves, kind of eased some of my concerns, because I found a lot of the supervision fears or concerns or problems people were seeing, and certainly not entirely, were regarding, I lost count of how many comments about master's level psychologists.
There, to that point, Jay, there were a lot, and that really struck me. I was kind of agog by the number of responses and the kind of the strength of the responses too.
Yeah, I would have, and again, and all these issues kind of end up tangling and start to sprawl from one another. But there is also concerns about who's supervising these folks and why can't psychologists supervise. I know that field, that licensure has done some work to allow some of that, but that was a very big concern about the level of training. And at the same time I say all this, I'm aware that that's not the licensure that we're concerned with. We don't have, that's not our domain in here. So
I think one of the concerns of that was sticking out to me when I was seeing this was the fact that if you look at the beginning, 81% of our respondents have been practicing for over 10 years. And so it's a pretty small percentage of folks that are responding that are really early in their career. And so it very much seems like it's looking down at the younger folks. And I would really want to know what more maybe younger folks are thinking in the field regarding what concerns they're seeing. Because the one thing that didn't come up in here really that much was the quality of supervision. So either we're doing a great job or the majority of people that are responding to this aren't in supervision anymore or haven't, and so that was just one aspect that I kind of take from this negative aspect.
No, thank you. I appreciate that. I think that it's really important that the voices of early career psychologists be that they be integrated and that their voices be encouraged. Anything else under the first point, under any practice-related negative issues?
One thought I had, and this goes back to the concern about practitioners conducting assessments in which they're not doing appropriate assessments, not doing the background work needed, not providing the right assessments. And I know there is a tendency that we are working towards reducing the continuing education burden. And I don't have those regulations in front of me, but maybe thinking about people who are going to conduct assessment, and I mean that very broadly, and that's probably an issue right there. But if someone's going to conduct assessment, require them to take continuing ed assessments.
On assessment.
Yeah, and again, that how that looks and whether that counts towards the all those details can be worked out. But I do think if someone is going to be conducting assessments, they need to be getting continuing ed on some level in assessments.
I was just writing that down because I think that it's really important for psychologists to continue to enhance their knowledge and develop new knowledge if they're going to be doing assessment, because assessment is not a stagnant or a stationary part of the work that we do. There are developments all of the time when it comes to assessments. I mean, I just remember when I started graduate school, we were on the MMPI 2, and now look at where we are.
Sure.
I don't remember the WACE 1.
You said you don't, or you do?
I do. That's what I was trained on. But I'm old, so.
Well, Richard, I know we're getting close to the end of the meeting. I kind of wanted to talk about next steps for some of the members of the committee, if that's okay.
Please, yes.
So this discussion is awesome. Really appreciate all of you digging into this, and it's really helpful to hear what you're taking away from these responses. Part of the reason why this survey report is so lengthy, it's 59 pages. We wanted to preserve the voice of the people who answered the survey. So we wanted to give summary information up front, but let you dig into all of the responses. And so continue to work through those. For the next meeting, if you could continue to look at that second item that's listed there that involves supervision. That question, go ahead and prepare for that for the next meeting. And then what we're asking the other advisory committees to do, so go ahead and do this as well. Review the responses for question 13, which involves any negative issues that we're seeing concerning telehealth or remote services. And then also question 16, and that one deals with, are you currently using artificial intelligence? And if you are, how are you using it in your practice? So for next time, go ahead and look at the supervision question, telehealth, and then also artificial intelligence. And then as some additional homework, I'll just jump ahead real quick. At the end of your agenda, you will see it says the next upcoming meeting, and under item A2, it lists several regulations that are all identified there. There's about 9 or 10 of them. One of the reasons why I put those there, and I talked to Richard about this, we've really made a concentrated effort to bring regulations to the advisory committee to discuss, make recommendations to. We brought some of the bigger ones to you as far as continuing education, documentation of continuing education, unprofessional conduct, educational qualifications for licensure, definitions. But there are a number of smaller ones. And we would like to be able to say that over the past few years, we have brought all the regulations in front of the advisory committees to at least take a look at, provide some input if you think there's things that should be changed. Some of these might be as small as a paragraph, but we attached copies with your materials. So between now and the next meeting, if you could review those and then come to the next meeting, able to discuss if you think there should be any changes. I'll have my staff also bring any recommended changes to the meeting, so that way we can review these fairly quickly, but make sure we're doing our due diligence as stewards of the regulations to make sure we're keeping things consistent with the statutes when those do get changed, and making sure there's no outdated terminology. And if there are regulations that are unnecessary anymore, there could be recommendations even to repeal those if they're no longer relevant or needed. So.
No, thank you, Dave. I appreciate that. Any last questions before we adjourn? Well, I'll take a motion to adjourn.
Motion to adjourn.
Multiple individuals have moved, and I think that's all that we need. Well, I'll take a second. Anybody want a second? I can second. And I think that's it for tonight. And our next meeting will be Tuesday, the 14th of October, 2025 at 6 p.m. And until then, you guys have a good rest of your evening.
Bye-bye.
Thank you.
Thank you.